let's continue on with our program. With that, I'm very pleased to introduce Dr. Hamish McNair, RN and EMEA Clinical Director. Mr. McNair has qualified as a registered nurse in 1985 and worked at the National Health Service for 4 years before joining the Royal Air Force as a nursing officer for 8 years. Upon leaving the RAF, he worked for Johnson & Johnson as a sales manager. He joined the aesthetics field 15 years ago and has been working for Candela for over 10 years as Director of Clinical Education in the EMEA region. Mr. McNair is responsible for managing all clinical matters within the region, as well as running the Candela European Institute of Excellence in Madrid, where great importance is given to research and development. With that, Hamish, I will pass the presentation over to you.
Thank you very much. And welcome everybody. Good afternoon or good evening, wherever you happen to be in the world. Over the next 35, 40 minutes or so, what we're going to do is we're going to talk about the GentleMax Pro Plus and how this system can enhance your practice. So, first slide. So, I guess the first question is, what is the GentleMax Pro Plus? It's dual wavelength. So it has both an Alexandrite and an Nd:YAG 1064 nanometer laser within it. It's multi-application, which means that we can offer a wide variety of different treatments within these two wavelengths that we have within the system. The largest treatment that we tend to see the machine being used for is laser hair reduction. And the reason that you see it sitting both under the Alexandrite and also the Nd:YAG wavelengths is because this allows us to treat all skin types from Fitzpatrick skin type 1 right through to Fitzpatrick skin type 6. So in general, we recommend treating skin type 1, 2, and 3 with the Alexandrite, and the darker skin type 4 and definitely skin type 5 and 6 with the 1064. In addition, the Alex allows us to treat benign pigmented lesions, and the Nd:YAG, we can treat vascular conditions, we can do facial treatments, and also we can treat onychomycosis or toenail fungus. And as I go through the presentation, what I will do is, one, highlight some of the differences between the GentleMax Pro Plus and the previous GentleMax systems. And also a little bit about each one of the treatments, but obviously this isn't intended as a clinical training webinar, it's more of an introduction to the system. So what are the differences, excuse me, between the previous GentleMax Pro and the GentleMax Pro Plus? There's a couple of significant things that make a big difference, one to the treatment time and also to the efficiency of the system. Firstly, we now have a larger spot size. So now we have a maximum spot size of 26 millimeters. And I'll go into a little bit more detail about why that is so important closer to the end of the webinar. And also we have a faster repetition rate. So now, depending on spot size, fluence, etc., we have a maximum repetition rate of 3 Hertz. So this is a very fast system, particularly with large spot sizes. From a treatment point of view, we have increased the fluencies available with those larger spot size to make them more efficient and effective. And really importantly, we have a 2 millisecond pulse duration. And this in particular is very useful when we're treating vellus hair. And as any of those of you that are familiar with the previous systems, the GMAX Pro, you'll see that it looks very slightly different, mainly due to the color, but the size and everything else is exactly the same. Handpieces, again, are very similar. So one of the things we find with our customers is they like a choice of either being able to use dynamic cooling for their system or to use air cooling. So with the Pro Plus, as with the GMAX previously, we have 2 options for cooling. We can either use the Cryogen DCD cooling, dynamic cooling device, or we can use air cooling. The option, but you have to specify which one of these two you want, because you can see from the images here, the handpieces are different whether you're going with the DCD, which is on the left, and the air cooling, which is on the right-hand side. Those of you not familiar with dynamic cooling, the big advantage with using this is we spray a very controlled volume of cryogen onto the skin. The system then will wait maybe 20, 30 milliseconds. And during that 20, 30 millisecond time, we get evaporation of the cryogen, which is cooling the skin. So this means even when we're using the machine in the very fast repetition rates of 3 Hertz, we know before the laser delivers its energy and therefore its heat, we have cooled that specific area just before the laser fires, making it very safe and very efficient. The second option, obviously, as I just mentioned, is air cooling. Air cooling is very efficient, but you have to just bear in mind that because we're using air rather than a cryogen with the evaporation, the cooling takes a little bit longer. So you are probably not going to run at the fastest repetition rates the whole time when you're treating with the air cooling, but still a very fast treatment. So let's look at some of the actual treatments we can carry out with the system. The biggest one we find obviously is laser hair reduction. And from a CE point of view, the definition, and this is really important that we understand this, that is the stable, long-term or permanent hair reduction. Permanent hair reduction is defined as the long-term reduction in the number of hairs regrowing when measured at 6, 9, and 12-month period after the treatment. The reason this is important is it's permanent hair reduction, not permanent hair removal. As your patients or your clients go through various stages of life, pregnancy, for instance, this can stimulate new hair growth. The menopause does the same, and a number of medical conditions can also stimulate hair growth. So we're talking reduction, not total removal. And how does it actually work? Well, we're targeting the pigment within the hair follicle. So looking at the image here, we're targeting the melanin within the hair, and we're actually using that hair to provide that heat to 2 main structures within the hair follicle itself. The first one is the bulb, or the root of the hair, which you can see in the diagram has the blood supply and nutrients supplied to the hair. And the second one is called the bulge, which sits around about where the erecti pillow muscle is. And this is where the stem cells are held. So if we can heat both the bulb and the bulge, firstly, we destroy the blood supply, so there's no nutrients to the hair. And secondly, by destroying the stem cells that are sitting in the bulge, there is no new hair going to grow within this individual follicle. However, we have to do a number of treatments in order to achieve the results, because we have various stages of hair growth. The area that we're looking for is the anagen phase. So this is where we have a complete structure. So the hair is actually touching the walls of the shaft. So we get that heat being transmitted directly into the bulb and into the bulge. But as you can see, as the hair goes through its other stages, that the hair starts to thin, it's no longer touching the sides of the wall of the hair shaft, and then it's going through its stage of shedding. So we don't have connection of a blood supply, and we don't have such close proximity to the bulge, so we're not destroying our stem cells, and we're not destroying the blood supply. So important that it's only during that anagen phase that we actually have the effect on the hair that we're looking for. And depending on the area of the body we're treating, we have different percentages of anagen hair. The reason this is important is when we're looking at actual time between treatments, so treatment intervals, If there's a very high percentage of anagen, as in the face, the axilla, or the bikini line, we can treat more regularly than we can if we're treating arms, legs, trunks, etc. So we have to moderate the length of time between treatments depending on the area we're treating. And studies have shown that we get an 80% reduction after a series of treatments. And in many cases, we get much higher than 80%, but this is the baseline, the minimum that we aim for when we're developing systems. And secondly, important as well, because we're targeting the melanin, the white, blonde, or gray hairs don't generally respond. And just looking at a couple of before and after pictures, this is specifically looking at using our 2 millisecond pulse duration. So historically, these hairs, when we get to maybe the 4th or the 5th treatment session, the hair is becoming much finer and it starts to become more difficult to actually get the results we're looking for. But as you can see, after a further 2 treatments using 2 milliseconds, we're getting a very, very nice clearance. There's virtually no hair left at all. And similarly in this picture. So we get really good clearance on those finer hairs using that 2 millisecond pulse. And again, similarly here. So moving on to the second treatment available, benign pigmented lesions. And it's important just to stress the fact that we're talking about benign pigmented lesions rather than anything else. Again, we're looking at epidermal lesions as opposed to dermal pigmented lesions. And these typically present as flat, fairly well-defined areas of additional pigmentation on the skin, but they can in some cases be oval or an irregular shape. And they vary in size dramatically as well. They can be small, and I'll show you some examples in a moment. They can be very small, millimeter, 2 millimeter, or they can be 5, 6, 7 millimeters in size. And in general, the commonest reason why we have pigmented lesions is ultraviolet radiation, so sun exposure. And the way the system works is it targets the pigment, the melanin within the epidermis, heats it up to a high enough temperature that it breaks it up. And then what you will find as the skin then turns over, that pigmented lesion will, the darker part of the lesion will crust and come away, and underneath it'll be a lighter color for the next treatment. So typical pigmented lesions we treat, so freckles, very common. You tend to see these in lighter Fitzpatrick skin types. Lentiginous, these tend to be larger in size than the freckles. And again, it's common for the reason for these to be exposure to the sun. And finally, cafe au lait. These are lighter in color, and as the name would suggest, they look like milky coffee in color, and they will vary dramatically in size. Sometimes you will see very small lesions, and sometimes they can be very, very large. But 2, possibly 3 sessions, and we see huge improvements in these pigmented lesions in the cafe au lait. Just looking at a few before and after pictures. So this is after 4 sessions, and it's 6 months after 4 sessions. So this lady is obviously now protecting her skin much better from the sun after the treatments. And similarly here, this is 2.5 months after 3 sessions. So a very nice clearance of the majority of these pigmented lesions. The next area I want to concentrate on is vascular lesions. And the ProPlus is particularly good at treating small vessels. Mechanism of action, how does it work? It's targeting the hemoglobin, either oxyhemoglobin, obviously in the red blood vessels rather, or the deoxyhemoglobin in the bluer, more purple colored vessels. And we have, in effect, two different mechanisms of action going on here. First of all, we obviously get the energy transferred into heat being absorbed into the hemoglobin. And if we get enough temperature into there, we actually start to coagulate those blood vessels. And secondly, some of that heat diffuses into the wall of the blood vessel. And because we have collagen sitting within the vessel walls, we get contraction of that collagen. And by contracting that collagen, we get a shrinkage or a spasm of that blood vessel, so it becomes much smaller. And this is particularly evident when we're treating very small vessels on the face, because we treat the vessel and you will see the vessel disappear. It's partly because we've coagulated the blood, but it's secondly because that vessel has constricted to such an extent there is no more blood flowing through it. And I will show you a video in a moment demonstrating that. So the clinical endpoints we're looking for, on the face, again, very important just to mention, we only use the 1.5 millimeter spot size when we're treating the face. And these tend to typically be maybe 0.5 millimeter, maybe 0.6 of a millimeter in size. Rarely are they much bigger than that on the face, except for vessels on the nose. And when you fire the pulse on these, they literally disappear straight after the pulse. Leg veins tend to be a little bit bigger. The small ones will disappear. The slightly larger ones may disappear for a moment. And then over the course of a minute or so, they will reappear, but they're a much darker color. And they almost lose their definition. They look like they've gone out of focus. And then you will see typically this wheel and flare effect, or what's sometimes referred to as a cat scratch, which appears after about 5 minutes. And this is the histamine release that's producing that wheel and flare effect. So you get quite a bit of erythema sitting around each one of those vessels, but that's a completely normal response to the treatment. Then there's a couple of things we need to think about very carefully when we're treating. First of all, we don't treat vessels bigger than 3 millimeters. The worry here is that we could actually disrupt these vessels and end up with bruising. Secondly, we don't treat varicose veins, as this could potentially lead to ulceration in the area. And finally, we have to leave a space of double the spot size between the pulses. So as an example, if we're treating a leg vein with a 3 millimeter spot size, we need to leave a 6 millimeter space between each one of the two pulses. So I'm now going to show you a short video, and this shows a vessel being treated. Hopefully the video will start. Bear with me.
The treatment endpoint is spasm and darkening of the vessel. It is also possible that the vessel will disappear momentarily.
So that one disappeared.
Once treatment is completed, follow the post-care instructions found in the clinical manual.
And here are some typical before
The treatment endpoint.
Thank you. So here we have some nasal vessels that have been treated. This is after a single session. Similarly, another set of nasal vessels. These are the vessels I said before are slightly larger, but we still never use anything more than a 1.5 millimeter spot size. And some leg veins being treated. In addition to both the hair removal, pigmented lesions, and vascular, we have other treatment options available with the machine. One of them is treating facial wrinkles. And I think, as most of us are well aware, as we get older, we stop producing collagen, and once we've got decrease in the collagen levels, then the elasticity of our skin decreases, and that shows as lines, wrinkles, etc. on the skin. So the idea here is, by the interesting thing, the difference between the other treatments and when we're looking at these facial treatments is, when we're doing hair removal, we're trying to destroy certain targets. When we're treating pigmented lesions, we're destroying a pigmented lesion. And similarly, when it's a vascular treatment, we're heating up the hemoglobins to such a temperature that we're actually coagulating, or in effect destroying that blood. Here, we're not looking at getting to those critical temperatures that we're actually destroying structures. We're producing a controlled thermal injury within the tissue. And with that thermal injury, we will get wound healing, and part of that wound healing is the body's response to that will be to produce new collagen. So we're targeting water more so than any other chromophore when we're using the Nd:YAG for this particular treatment. Bear with me. So the treatment technique itself, here we're doing what we call a painting technique. So we don't use any cooling, because obviously we're wanting to heat up the epidermis and in turn then the dermal layers. And we run a very high repetition rate between 5 and 7 hertz. And we want the surface temperature to be in the region of between 40 and 43 degrees. And then, if possible, we maintain that temperature for 2 or 3 minutes in an area. Then we move to another area, do the same thing, etc., etc. And then generally, I will come back and do a second round of treatments on each area, just to maintain that temperature. Because the more temperature we can maintain in the tissue, the more stimulation of collagen, so the better the end result. And looking at end results, this is 3 months after 4 sessions. It's a very comfortable treatment because it's just gentle heating rather than putting the heat in a very high temperature very quickly. So it tends to be a very comfortable treatment for your patients. The final treatment area we have with the system is onychomycosis, or toenail fungus treatments. For this, we're using a 5 millimeter spot size. And again, this is about gradually building up the heat, so we're destroying the fungal spores rather than delivering a single high energy pulse. So as you can see from the diagram here, we deliver multiple pulses, very short pulses, over the area until we bring up the heat. And generally what we're looking for here is, on the big toe, we want to achieve 600 pulses. On each of the other toes, we're looking at achieving 100 pulses. And this is what the treatment will look like. So this is 6 weeks after a single treatment. We do recommend multiple treatments. Depending on the severity of the situation, it can be anywhere between 4 and 6 sessions, and we space the sessions 4 weeks apart. So what I want to do in the second part of the webinar is to really focus a little bit more on some of the differences with this system over the previous GentleMax Pro. One of the big differences is the increase in the spot size. And the purpose of increasing the spot size is in order to allow clinics that are focusing on hair removal to be able to treat particularly larger areas much more quickly using that 26 millimeter spot size. But you'll also notice from this chart, we have a wide variation of different spots, going from a 1.5 millimeter, right the way through to the 26. The reason that we have so many different spot sizes is that they're very specific to individual treatments that we're doing. So the 1.5, the 3, and the 3 by 10 millimeter we're using for our vascular treatments. The 5 millimeter is for the toenail fungus. We are doing some work at the moment on using a 6 millimeter for some bigger vessels on legs, for instance. And then we're moving 8 and 10 tend to be for pigmented lesions, or if we're doing diffuse redness. And then we move into the bigger spot sizes that generally are for hair removal. So anywhere from 12 millimeter right up to 26 millimeters. And it means not only is it faster because we're covering a bigger area, but secondly, it means that you're actually firing less pulses. So we're firing less pulses, we cover a bigger area, and we have a faster repetition rate. So the combination of all of these factors together means that we end up with potentially a much faster treatment, which ultimately means that you will be able to treat more patients within a day than you would using a smaller spot size when you're doing hair removal. I mentioned about the difference between the two different ways that we cool the system, either with the dynamic cooling device or our DCD, or secondly with air cooling. So let's look at an example of the difference in the time it takes to treat a man's back, depending on the spot size that we're using. If you were using a traditional 18 millimeter spot, it would take around about 29, 30 minutes to treat an average man's back. And you can see as we move to the 20, to the 22, to the 24, and then right up to the 26, you'll see that treatment time is reducing. And if we treat using the larger spot, the 26, that treatment time is only 19 minutes, which actually is 34% faster than using an 18 millimeter. So it means that we're treating that area much more quickly. And secondly, we're using less pulses. So we're using less than, well, about 50% of the pulses, 52%, when we're using a 26 versus an 18 millimeter spot. And the important thing being, if you were looking at an average day in a clinic with 8 hours of treating, if you're using your 18 mil spot, it's about 16 sessions in a day. But if you move up to a 26 millimeter spot and you're treating a man's back, you're up to 25 treatments within one day. So you've got a significant increase in the number of treatments you can do, and that obviously then translates into bigger revenue. Similarly, if we're looking at women's legs, here you can see using an 18 millimeter spot, it takes around about 25 minutes to treat full legs. Whereas when we move into the 26 millimeter spot, we're now down at 17 minutes. So 32% less time taken to treat with a 26 mil as opposed to an 18 millimeter spot. And you can see similar picture when it comes to the number of pulses. We're actually delivering 52% less pulses when we're using 26 versus the 18 millimeter spot. And this again, number of treatments, this relates to if we're using an 18 millimeter, you could treat 19 patients within one day, whereas when we're using 26, we've moved that up to 28 treatments within a single day. So big increase in the throughput and therefore the revenue. And just a quick couple of summary slides talking about the the Gentle series as a whole. We have over 25 years of expertise within hair removal and within the Gentle series. We have systems in 88 countries. That's probably more than 88 countries now. And we're seen as the #1 provider of energy-based devices within our aesthetic industry. And again, that number of 14,500 will be higher now because this slide is a few months old. I mean, it's our biggest selling system globally. So that number is constantly increasing. So finally, why is it that you would choose not just the GentleMax Pro Plus, but a Candela system? You know that when you're buying one of our systems, you're buying a system that has been looked into very carefully from a research point of view. We have clinical papers covering all of the different treatment options that we provide with the systems. And from a patient's point of view, that then relates to the comfort, the safety, the efficiency, which everything is important, but I think the efficiency. So when your patients come into the clinic and they're specifically, let's say they're asking for hair removal or hair reduction treatments, and you're using the Gentle Pro Plus, they know they're going to get good results because of the efficiency of the system. It's comfortable because of the 2 types of cooling we offer. It's safe because we have 2 options of wavelengths depending on the skin type of the individual you're treating, and the speed, so they're not sitting in the clinic taking a long time having their treatments. And this is based on the increase in our spot sizes and also the repetition rate. And the other point about the efficiency is that we now have that ability to offer a 2 millisecond pulse duration, which dramatically improves the end result when we're treating that very fine, almost vellus hair, which is something that I think is a major advantage that we have with the GentleMax Pro Plus. And it's enhancing your practice. It gives you the best option from a laser hair removal point of view. It gives you versatility in the number of treatments because it's not just a hair removal device. We can treat pigmentation, we can treat vessels, we can do diffuse redness, etc. So a large number of different treatment options available. You know when you're buying a Candela system that you're buying a quality system, which is reliable. And because of the way we develop the systems, you know that you can push that machine really hard on a day-to-day basis in your clinic. And finally, the partnership we have with our customers, the commitment to providing effective, efficient systems that will deliver treatments particularly treatments that your patients are looking for, which of course is very important. And as the markets move and trends change, then we are constantly looking at developing new treatment options that fit in with those new wants and needs of your patients. We have 50 plus years of experience within the industry. And as I said, meaningful innovation whereby we are looking at providing solutions to problems your patients come into your clinics and ask you about.